Did you know that just 6 small mistakes when eating garlic can turn this seemingly harmless spice into a deadly poison? Garlic, a natural remedy that humans have used for thousands of years, is famous for its anti-inflammatory power, its ability to protect the heart, and its role in strengthening the immune system. But what most people don't realize is that the very way they use garlic could transform it from medicine into a hidden danger. In today's video, we will expose 6 deadly mistakes people make with garlic, starting from the least harmful to the one that could cost you your life. And make sure you stay until the end, because I'll reveal the safest, its most effective way to use garlic. You can reap all its benefits without the risks. In both ancient medicine and modern science, garlic has been celebrated as one of nature's greatest miracle cures. Studies show that garlic can lower blood pressure, reduce cholesterol, thin the blood, strengthen the immune system, and even fight cancer. Because of these benefits, many people believe that the more garlic you eat, the healthier you will be. But the truth is the exact opposite. When used incorrectly, garlic can push your body into dangerous territory. Let's begin with the first mistake, the least dangerous mistake, but one that can still lead to tragedy, is storing garlic incorrectly. Many people soak garlic in oil to use as flavoring. But when left at room temperature, you are unknowingly creating the perfect environment for the deadly botulinum bacteria to grow. This bacteria produces a toxin that can paralyze your muscles and shut down your breathing. The terrifying part is that the toxin has no smell and no taste. You won't know it's there until symptoms appear. One study recorded 48 cases of botulism poisoning linked to garlic stored in oil, and 23% of those patients required machines to help them breathe. The simple solution: if you want garlic oil, always refrigerate it and use it within 1 week. Or add acid like lemon or vinegar, which prevents bacterial growth. The next mistake is even more dangerous: eating garlic together with diabetes medication. People with diabetes often take garlic for its natural blood sugar lowering effects. But if you are already taking insulin or metformin, this can be a recipe for disaster. Garlic increases insulin sensitivity, which can cause your blood sugar to crash to dangerous levels. In one study from India, 31% of patients who took garlic with their medications suffered severe hypoglycemia, and some were rushed to the hospital. One case involved a patient who slipped into a coma while sleeping because he'd combined 4 cloves of raw garlic daily with his medication. The fix is not to avoid garlic completely, but to eat it with meals. Start small. Monitor your blood sugar closely, and most importantly, tell your doctor that you are consuming garlic. Another mistake, which may sound harmless but is extremely dangerous, is eating raw garlic on an empty stomach. Do you chew raw garlic in the morning for immunity? If so, beware. Eating raw garlic on an empty stomach can be catastrophic, especially if you have ulcers or digestive issues. The sulfur compounds in garlic can burn through the protective lining of your stomach, causing bleeding ulcers. A woman in Miami ended up in emergency surgery after eating just 3 cloves of raw garlic every morning. Her ulcer burst and she began vomiting blood. For people with Crohn's disease or ulcerative colitis, the effects are even worse, triggering severe flare-ups. The solution? Never eat raw garlic on an empty stomach. Always combine it with food, or better yet, cook it lightly or use aged garlic extract, which is much gentler on the stomach. The next mistake could directly threaten your life in the operating room. Eating garlic before surgery? Garlic is a natural blood thinner. If you eat large amounts of garlic before a medical procedure, you could bleed uncontrollably. A study of more than 4,800 surgical patients revealed that almost 9% of unexplained bleeding cases were linked to garlic consumption. One patient who ate the equivalent of 15 cloves a day nearly died during gallbladder surgery because the doctors couldn't stop the bleeding. The rule is simple and non-negotiable: stop eating garlic, including supplements, at least 10 days before any surgery, whether it's major surgery, dental work, or even a simple biopsy. Now we come to a mistake that has grown popular because of the detox trend: eating massive amounts of raw garlic. Some people eat entire bulbs, 20 or 30 cloves a day, thinking it will cleanse their body. This is incredibly dangerous. At Stanford University, doctors documented 67 cases of garlic poisoning in just 2 years. many involving chemical burns to the throat, red blood cell destruction, and organ damage. One fitness influencer collapsed after eating 25 cloves of garlic every day for a week. Her blood count dropped so low that she required multiple blood transfusions. The safe limit: 1 to 2 cloves per day, with a maximum of 4 cloves if spread out across meals. Remember, more does not mean better. And finally, the most dangerous mistake of all: eating garlic while on blood-thinning medication. Hundreds of deaths have been reported due to brain hemorrhages and internal bleeding caused by this combination. One man in the US died from a brain bleed while sleeping, simply because he took a garlic supplement on top of his prescribed warfarin. Even small amounts can be risky. Another case involved a woman who lost vision in one eye after eating garlic bread while on blood thinners. The bottom line: if you are taking anticoagulant medication, do not use garlic in medicinal amounts. Small amounts in food may be tolerated, but only under close medical supervision. So how should you use garlic? Safely and effectively. Here are the golden rules. Crush or chop garlic and let it sit for 10 minutes before cooking. This allows the key compound allicin to fully develop, increasing its potency almost 20-fold. Cook garlic gently at no more than 140 degrees Fahrenheit for up to 15 minutes to preserve its active compounds while reducing stomach irritation. Always eat garlic with healthy fats like olive oil, which boosts absorption by 45%. The optimal dose is just 1 large clove per day, around 4 grams. If raw garlic bothers your stomach, consider aged garlic extract or black garlic, both of which are rich in antioxidants and much easier to digest. And remember to store garlic in a cool, dry place, not in the refrigerator, to avoid mold growth. Garlic truly is a powerful medicine, but it can also become a poison if used incorrectly. The 6 mistakes we just explored have harmed, and in some cases killed, countless people. The good news is that by respecting garlic's power, using it in the right amounts, and adapting it to your personal health condition, you can safely unlock its benefits. So now I ask you, do you eat garlic every day? Have you ever made one of these 6 mistakes? Share your experiences in the comments below so we can all learn from one another. Don't forget to subscribe to the channel for more hidden health secrets that could save your life.